Hi, my name is Sharon Knoll, and I am an RN at Vista Hospital in Louisville, Colorado. Yes, I work here at Vista, and I have worked here for 21 years. I work in the neonatal intensive care unit and in the GI lab. I split my time between both areas. I've worked in the NICU for 19 years, and I've worked in the GI lab for the past 3 years. In the NICU, I either am taking care of our sick and premature babies, or I am going to deliveries. We go to every delivery here at Vista, whether it be a well baby or a sick baby. I go with a nurse practitioner, which we have on staff 24/7. If it is a high-risk delivery. Day in the GI lab is we do colonoscopies and upper GIs, and so I do pre-op, post-op, and circulating, where I'm documenting what the doctor is doing during his procedure. A typical day in the NICU is a 12-hour shift. It starts at 7 in the morning and ends at 7:30 at night. If I am in the NICU taking care of premature or sick babies, I usually have 3 babies, unless I have a very sick baby, and then it's a 1-to-1 assignment. I take care of babies on ventilators, gavage feedings, which means there's tubes in their nose that goes down to their stomachs, and we feed them through a tube. They have respiratory issues, so they're all on different kinds of respiratory machines, and just trying to get them to grow and be healthy. My coworkers in the NICU are primarily women. I think that the standard thought of people is that most nurses are women. We do have one male nurse in our NICU, and I have to say it is nice to have him there. It brings a different light to the workplace to have a male in a typically all women area. Yes, in the NICU, because we have one male nurse, he is required to go to the deliveries just like we are, and to take care of the babies in the NICU along with the moms. And some of the women, there are times when he is going to deliveries that the patient having the baby does have a hard time with him being in the room. And afterwards, helping with breastfeeding and such activities. So there are problems with that. I feel more so than when a woman goes into the delivery. One of our coworkers that's a woman goes in for the delivery and or is helping with breastfeeding. It's fine when the women do it, but when the male nurse goes in, there are issues. I feel very uncomfortable. They have asked him to leave and not be in on the delivery or to help with breastfeeding, which in turn is telling him not to do his job. In the GI lab, the male nurses that I do work with have gone on to further their education to become CRNAs, which are certified registered nurse anesthetists. So they're the ones that are in charge of putting the patient to sleep. And I have to say that patients, even though they're still nurses, the men that I work with are still nurses, patients talk to them and respond to them as if they are doctors, compared to when a female nurse comes in and tells them the exact same thing, as if I went in and said the same thing to them. They tend to listen more to the male nurse, responding to them as if they were the doctor. Sometimes the physicians and patients respond to the male nurses with a little bit more information at times, and kind of assume that the women that are there are just nurses and have not excelled in their education as the male nurses did.